My name is Yvonne Drazik, and I was born in Switzerland in 1966, came over to Australia in 1994, and I have lived with chronic hepatitis B most of my life. I am a mother of 2 children. I'm also doing research now into hepatitis B because it is so relevant to me, and I really want to make a difference there, and I want to do something about it because I know how neglected and under-researched it is. So I'm doing this research project at the moment with a community that is highly affected, that is the Hmong community. They're refugees.
My name is Jenny Lai. My background is Hmong, and my parents originate from Laos, and my father fought in the Vietnam War, and part of that war they had to run away from Laos, and they crossed the Mekong River and became refugees in Thailand.
Then spent up to a decade, I think, in Thailand, in refugee camps in Thailand, and then they came as political refugees to Australia and went to America.
I was actually in my mum's belly when I came to Australia, so I was born in Sydney, so I have the citizenship. And after that, my parents wanted a warm climate, so they started to explore, and they went north and they found Queensland.
According to research in America, they would have a really high prevalence of hepatitis B, but almost no knowledge about it. And here in Cairns, we do have quite a large Hmong community, so I thought it is a good opportunity to help them.
And I'm very thankful that I've met Yvonne here, who's doing research on hepatitis B and the effects it has on our community. Just shows that there are people out there who actually care for us.
Do you want a cup of tea? Yes, please. Okay. It's quite likely that I have been infected as a young child, although I am not quite sure about that because I never, I kind of accepted the fact that I'll never know how I got this virus. I was diagnosed when I wanted to give blood for the first time. I went to the doctors, had a few tests, and it was confirmed that it was actually chronic hepatitis B. But at the time, that was in the 80s, sometime early 80s, there was really not much information out there at all. So eventually, I was just told that I was a healthy carrier of hepatitis B, and that for me meant, the word healthy means that you don't have to worry about it. And also my parents didn't seem to be too worried. I don't know what exactly that meant, they just weren't talking about it and really didn't seem very interested about it. But that doesn't mean that they really weren't. But I was a bit of a difficult teenager at that time, so I interpreted that just as, probably it couldn't be too bad then. So I didn't worry about it for many, many years. My husband, when we got together, I already knew that I had Hep B, so he got tested, and it turned out that he was already immune, so he must have been exposed to it at some point. Then when we had the children, the midwives or the doctors, they all knew I had Hep B, so basically there wasn't much mention of it, but I just trusted that the midwives would do the right thing, and the doctors. So the kids both got immunized properly. They're Hep B free. Research has shown that mothers who test positive or who are positive for chronic hepatitis B during pregnancy are then after the birth not being followed up, which of course is not good enough. This is a great opportunity to detect and find out that somebody has chronic hepatitis B, so it's not acceptable if then after the birth of the child this woman is not being followed up. And this happens apparently still quite a lot. I'm Yvonne Drazik. I'm at JCU doing a PhD research in hepatitis B. and I've got hepatitis B myself. So when the kids were still quite young, I did actually get some kind of a symptom, and it was just, it's a mild discomfort, not really painful, but you can feel something in the area where the liver sits. And it was so mild that it's very easy to ignore, so for a long time I didn't think much of it. And then, I suppose I belong to those people who put things off. When I got the diagnosis of the early cirrhosis, that was probably the lowest point that I had, but I am a positive person generally, an optimistic person, so it didn't, I didn't stay down for long. I had a lot of support from my family. They were probably even more worried than I. And that means, my immediate family here, my husband and my kids, they're great. Then I had great support from Rhonda Lewis at the Cairns Sexual Health Service. She's just awesome, she's become a good friend in the meantime. And I met some other people as well who have hepatitis C mainly. So we've got a good group there now, but the most support at the beginning, before I met all those people, I again got from the HB list, the online list. That was basically always quite enough for me of support that I needed, so I didn't get emotionally too down or anything. Through that I got into the whole research in hepatitis B theme because it interests me. So many people present really late, present maybe even in the late stages of liver cancer, when they then really only survive for a few months, and it's too sad. We can't have that happen anymore.
I have a cousin who is living in Hobart, Tasmania.
Okay.
So I sent.
Was anyone aware that hepatitis B could be a problem in the Hmong community, in the Hmong people? Or?
Yeah, most people, they don't know about the Hep B, but the nurse and the doctors, they also teach the Hmong who's in the hospital that hepatitis B is things to know about and to learn how to
something to look out for.
Yes.
In the Hmong community, the person I've been working most with is Mr. Wang Yi Cheng, and he is a community leader, a respected person in the community. And for example, one thing I did was recording a little video with him in Hmong language, where he talks about the project and encourages people basically to be involved and participate. It's quite a story, Wang Yi. I've always I can't. That is known that all Asian migrants are affected by hepatitis B, highly affected. It's just that this group, that it could be even higher than, for example, Chinese people. I think that's not well known yet.
They said that when you get to Australia and then you go straight to your family doctors, because they have family doctors somewhere, that when we arrive in the first week, we have to see the doctors to check, do blood tests, everything.
Okay. And then you think they tested for hepatitis B as well?
Yeah. They test everything. Yeah.
Okay. Yeah. They mostly don't know that it is a problem that could be affecting their community more than others. Generally, there's a lot of people also who don't know much about what's going on in the body in the first place. So, you have to start at the very basics and explain what the liver is, what the liver does, and how it can be affected by hepatitis B.
Since meeting you, actually, I've talked to a few people, but none of them are aware of it. Even though they're educated now, they've been to doctors and hospitals, and a lot of them have given birth as well, and they still don't know much about Hep B.
All
And it's only
right.
once I've mentioned it through you that they've actually done some research on it.
Okay.
So even the younger generation is still unaware of it.
It's interesting because... and then there's Jenny Lai, who I've only met probably a couple of months ago, and she has just been such a big help with telling me about things that Mr. Chang might have just not thought about telling me, for example. So just a different perspective, and I've since talked to about 2 or 3 other people and had all these conversations about hepatitis B and about healthcare in the community. So it's helped a lot. We're going to do some education sessions and hopefully get as many people as possible to come to those. So that's where you can help me with, to try and get those people to give the information first, and then attend those education sessions, and then hopefully know enough about it that they can look after themselves.
The Hmong people in the past years, and the Hmong people, they don't know about the disease because they have no technologies how to see that what is disease is. The Hmong just only know about shaman. So even the people have disease, so they say, okay, shaman said this and that, and the people still die, and they see people still die. So after the Hmong people has educated a bit, and they know that the disease is the disease, and the Holy Spirit, the soul is the soul. So they are in different way.
In most communities, like in Cairns and Innisfail, there are shamans, and shamans come. The shamanistic way is very it's passed down through our history, and to be a shaman, there's many rituals that you have to go through in order just to be a shaman, and then the process of actually health-wise of healing someone or looking after someone is all depending on each shaman as well. We do have the traditional hospitals and doctors that we go to because we are in a civilized country, but the shamanistic way is still very prevalent in most of the communities up here.
You can eat them raw.
In my experience, once there is something that is wrong and they're aware of it, then they do follow the checkups and they do follow the appointments that are in place for them. So yeah, definitely yes. If there was, especially if there's a reminder, then there's no reason for them not to go. So.
And even older people as well,
yes.
do you?
Yes, because then there is awareness and there's concern there, and a bit of urgency put in place. So.
There are a few things, you maybe want to adjust once you get a diagnosis of cirrhosis, especially. No alcohol, so as soon as I got that diagnosis, I didn't touch a drop anymore. Never had a problem with that, it was okay, just got used to it. Otherwise, I think probably always ate quite healthy. I have one thing, and that's chocolate. I eat heaps of chocolate, but otherwise I do have a healthy diet. I don't eat a lot of junk food at all, no fatty meats and stuff. So I think a good balanced diet with lots of fresh fruit and vegetables will do. That's, you don't have to overdo it or anything.
Oh, Jenny.
If I heard that somebody got diagnosed with hepatitis B, it's very, very important that they tell their family and the people around them and the people they grew up with, especially in the same household. It's very important that contact tracing is done, and everyone who has been living in the same household and has been growing up with the person should get tested just to make sure. There's no guarantee or no 100% risk that they would have it too, but there is a risk, and just have to make sure.